Hi, my name's Danielle, and today I'm going to talk to you about angina and specifically angina in regards to exercise. So, angina is classified as chest pain or discomfort that is caused when the heart doesn't get enough oxygenated blood. They can feel like pain or pressure in the chest, but sometimes the pain can occur in other places like the shoulders, the arms, the neck, the jaw, or the back. Sometimes people say it even feels like indigestion. However, it's important to remember that angina itself isn't a disease. It's actually a symptom of an underlying problem, and that problem can sometimes be coronary heart disease, and that's very common. A common cause of angina is when ischemia occurs in coronary arteries, which means that they're blocked or narrowed. There are a few different types of angina that people can experience. The first is stable angina, which occurs when the heart needs more blood than what it's getting, which can happen during physical activity or any type of strong emotion. Usually, severely narrowed arteries can get enough blood to the heart when the demand is low, like while seated or at rest. But when there's physical exertion, such as walking or climbing stairs or doing any daily activities that require exercise, the heart works harder and therefore needs more oxygen. Some signs that one is experiencing stable angina is it's not a surprise, you know when it's going to come, and the episodes are common, like you know when you're going to walk, after 5 minutes, you're going to start getting chest pain, or when you're climbing steps, after you get to 2 stairs, you're going to start feeling chest pain. It usually lasts for a short period of time, less than 5 minutes, and can be relieved by rest or medicine. On the contrast, unstable angina is a lot more serious and occurs unexpectedly and usually during rest. It's sometimes referred to as acute coronary syndrome and is a result of fatty buildup in the arteries, also known as atherosclerosis. This can rupture, causing injury to blood vessels and blocking the flow of blood to the heart. Unstable angina, unlike stable angina, is an emergency. If one has persistent chest discomfort, they should go to an emergency room, for they could be having a heart attack, which leads to an increased risk of cardiac arrest, which eventually could mean sudden death, and nobody wants that. Some signs of unstable angina are chest pain during sleep or rest, comes as a surprise, unlike stable angina, you never know what's going to happen, and it lasts longer. Rest and medicine usually don't do anything to relieve it. Another type of angina is Prinzmetal angina, which is unusual and often triggered by either exertion or emotional stress. It also occurs at rest, usually between midnight and early morning. It occurs more commonly in young patients and is caused by a spasm in the coronary arteries. And the last type of angina I'm going to talk about is microvascular angina, which is a symptom of coronary microvascular disease, which is a heart disease that affects the heart's smallest coronary artery blood vessels. Spasms in these walls cause reduced blood flow to the heart, which causes chest pain or microvascular angina. This pain can usually last longer than 10 minutes and sometimes can even take a half hour or longer. There are a few factors that put people at a high risk for angina. Having a coronary heart disease or coronary microvascular disease is a huge factor. Other factors can be high blood pressure or hypertension, which is the same thing, which is systolic blood pressure over 140 or diastolic blood pressure over 90. Smoking is also a huge risk of angina, so don't smoke if you do. Diabetes or fasting plasma glucose of over 126. Overweight or obese, which is a BMI of over 125 for overweight, or 25 for overweight, and 30 for obese. Metabolic syndrome, physical inactivity, which is less than 30 minutes of exercise 3 days a week for at least 3 months. An unhealthy diet, being older than 45 for a man or 55 as a female. And lastly, family history of early heart disease. Any type of chest pain should be checked out by a doctor, so he or she can find out whether or not it's angina, and if it is it stable or unstable angina. If it is unstable, then the patient may need emergency treatment to prevent a potential heart attack. A doctor will probably perform a physical exam and ask about symptoms and risk factors. The doctor will probably ask questions like, how long have you had this condition? On a scale from 1 to 10, what's the level of discomfort? What behaviors provoke the pain? And what relieves the discomfort? The doctor may recommend other tests such as an EKG, stress testing, blood tests, chest x-rays, coronary angiography, or computed tomography angiography. There are 4 key forms of treatment for angina. These include lifestyle changes, medications, cardiac procedures, and cardiac rehab. These treatments can reduce pain and discomfort and often help the angina concur. This can prevent or lower risk of heart attack and death by treating the underlying cardiovascular condition. However, not all chest pain is a result of heart disease. There are a variety of lifestyle changes that one can make to reduce the angina symptoms. The first key change is to quit smoking. So again, if you're a smoker, quit smoking. Second is to choose healthier, more nutritious foods. Patients should also aim to lower their cholesterol levels and blood pressure. Physical activity is a huge factor in reducing symptoms of angina. A patient should strive for at least 5 days of 30 minutes. Aiming for a healthier weight is also important and can be achieved through exercise and a healthy diet. Managing diabetes, reducing stress, and limiting alcohol can all also contribute to alleviating symptoms. Of the top lifestyle changes, there's also a variety of medications that can be taken to alleviate symptoms of angina. One should consult with their doctor before taking any medications. The common ones include anticoagulants, antiplatelets, angiotensin-converting enzyme inhibitors, angiotensin II receptor blockers, beta blockers, calcium channel blockers, cholesterol-lowering medications, diuretics, and vasodilators. There are several surgeries and procedures that can help with coronary heart blockage, and anything that helps with this blockage should also, in turn, help with the pains of angina. Some of these procedures include angioplasty, artificial heart valve surgery, bypass surgery, cardiomyoplasty, heart transplant, radiofrequency ablation, stent placement, and transmyocardial revascularization. Cardiac rehab is also a huge help in improving the future of the heart. Although it was damaged in the past, you can always recover from it and help get the body back on track to what it used to be. Cardiac rehab is a medically supervised program that can improve cardiovascular health. It includes 3 equally important parts, which are exercise counseling and training, which involves exercise and getting the heart pumping and promoting health in all parts of the body. Education for heart-healthy living, which helps to manage risk factors and aids in choosing good nutrition. And counseling to reduce stress, which helps to identify stressors in everyday life and how to cope with them. Now let's talk about exercise and why it's important, especially for those with angina, as well as those without angina. It's important for everyone. Regular exercise is one of the best and most important things that can be done for the body, again, whether the person has angina or whether they don't. It can help control weight, reduces risk of cardiovascular disease, reduces risk for type 2 diabetes or metabolic syndrome, reduces risk of some cancers, strengthens bones and muscles, improves mental health and mood, improves ability to perform daily activities and prevents falls, and increases chances of living longer. And also, notice that many of these benefits of exercise are goals that I previously stated, such as helping with diabetes, helping with mood, helping with weight control. So all of these, exercise kind of encapsulates all these different things that one should work on with angina to relieve the symptoms. There's also certain things that exercise helps with, specifically angina. For example, it causes a reduction of stroke volume, left ventricular ejection fraction, cardiac output, and blood pressure. And benefits of exercise for those with angina. They can perform work at a higher rate, so for example, they can work harder without feeling the symptoms of angina. It reduces the frequency of and duration of symptoms. It reduces the overall cardiac risk and improves the quality of life. Now, there's a bunch of contraindications to exercise that you shouldn't do. Well, for example, if you have any of these, you shouldn't exercise. You should go see a doctor. You should not exercise if you have any of these conditions, which are acute myocardial infarction within 2 days, ongoing unstable angina, uncontrolled cardiac arrhythmia with hemodynamic compromise, active endocarditis, symptomatic severe aortic stenosis, decompensated heart failure, acute pulmonary embolism, pulmonary infarction, or deep venous thrombosis, acute myocarditis or pericarditis, acute aortic dissection, and physical disability that precludes safe and adequate testing. There's also angina-specific contraindications to exercise, and the absolute ones are a drop in systolic blood pressure over 10 from baseline, accompanied by the evidence of ischemia, which is important, moderately severe angina, which is a 3 on the scale from 1 to 4, and ST elevation on an EKG of over 1 millimeter in any leads on the EKG except for V1 and AVR. And the relative contraindication to exercise is the drop in systolic blood pressure of 10 with no other signs of ischemia. So when you have angina, there's a bunch of exercise requirements that you should look out for while you're exercising to help alleviate the symptoms and make sure you don't hurt yourself. Second, education is crucial for those with angina, and they should be able to define angina and their symptoms, identify provoking factors, describe immediate treatment for their angina, understand the upper limits for exercise. For example, if their ischemic threshold is at 150 beats per minute, they should know not to go above 150 beats per minute or it will cause angina. And they should also be able to describe effects for their medications on exercise. And any change in frequency, type, or severity of angina, either before, during, or after exercise, should be reported, and a doctor should definitely be consulted. So, the ACSM guidelines for those with angina for aerobic activity, they recommend a relatively moderate intensity for at least 150 minutes a week, whether that is 15 periods of 10 minutes or if it's 5 periods of 30 minutes, they should just at least strive for 150 minutes a week of exercise. They should also incorporate muscle strengthening, which is 2 or more days a week, usually like 2 to 3 days a week, incorporating all of the major muscle groups, which is legs, back, hips, arms, abs, chest, shoulders, and then they should also do flexibility exercises daily. So for my case study, Gabby Kane is a 42-year-old woman experiencing stable angina while performing her daily activities, such as just going day to day, doing whatever she has to do, cleaning the house, running errands. When she exerts too much energy, she's having chest pain. She desires to exercise to prevent the need to take medications or have any procedures further on, and wants to relieve the pains of her angina now. She has no family history of cardiovascular disease. She's never smoked, but she has been inactive. Gabby's BMI is 23.5 and her blood pressure is 126/84. Her LDLs are 155 and her HDLs are 40. Her fasting glucose is 96. So, to assess the risks, her age is not a factor because she's below 55 as a woman. Her family history is also good because no one in her family had any cardiovascular disease at a young age. She doesn't smoke, however, she does have a sedentary lifestyle. She hasn't worked out. She's not obese. Her BMI is below 25 or 30 for obesity. Her blood pressure is normal. Her cholesterol is normal, and her fasting plasma glucose level is also normal. So we performed a Bruce test for her exercise tolerance test, and she stopped the test at phase 3 because she recorded a 3 on the angina scale. Her blood pressure was up to 155/86, and her beats per minute were her blood pressure or her heart rate was 150 beats per minute. So that's her ischemic threshold. So the exercise prescription for Gabby is she's going to exercise 3 to 5 times per week for cardio. Her intensity, the heart rate is going to be between 110 and 140 because her threshold is 150, so we have to keep it 10 beats per minute below that. So her upper limit is going to be 140. The time is going to be 150 minutes per week. Again, striving for every day, but 150 minutes per week at the least. And the type can be whatever she wants, either walking, elliptical, or bike. For resistance training, she's going to be training resistance 2 to 3 times per week. The intensity is going to be 50 to 75% of her 1 rep max. The time is going to be about 60 minutes per week, and the type can be free weights and body weight. For flexibility, she's going to be doing flexibility exercises daily. The intensity is to the point of slight discomfort. The time, she's going to hold the stretch for 30 seconds, and she's going to do about 10 to 15 minutes total of stretching. She can do whatever she wants, whether it be stretching, Pilates, or yoga. And these are my references. Thank you so much for watching.